If you are suffering with back or neck pain, you are not alone. Statistics show that back pain is the second most frequent complaint during primary care visits, and it is consistently one of the top 10 reasons people visit their doctor. Unfortunately, many chronic back pain sufferers have not experienced or even heard of spinal decompression therapy. In this video, we'll discuss the different causes, forms, and common symptoms of back pain, why in most cases surgery with its associated risks should be your last resort, how long-term reliance on over-the-counter and prescription pain medications can be very dangerous, and what spinal decompression therapy actually is, how it works, and why it's a real breakthrough in the treatment of lower back pain, even for those who've already had back surgery. If you are a back pain sufferer, then like others in similar situations, you're probably frustrated and you're desperate for relief, and you may be even considering surgery as a last-ditch effort to end the pain and suffering. It's important to know you are not alone. 80 to 90% of all adults will suffer with lower back pain at some time in their life. For people under 45 years of age, the so-called prime of your life, lower back pain is the leading cause of disability. And lower back pain is also the third leading reason for hospital admissions. Every year, people in the United States spend between $20 and $75 billion on the treatment of back pain, with associated costs like lost work production and wages. Studies have shown that 15 to 20% of our population has back pain at any given time, approximately 32 million new cases a year. Back pain is usually the result of a structural problem related to the spine, and the pain will continue until the structural problem is addressed and corrected. Overall, spinal discs are very strong and can normally withstand a great deal of wear and tear. However, they are very susceptible to injury resulting from repetitive activities and improper spinal loading. As the stress on the disc increases from repetitive lifting or from simply sitting in one position for long periods of time, day after day, the fibers begin to gradually break down. This creates small cracks and fissures in the discs, creating a pathway for the soft inner nucleus to slowly push outward towards the spinal nerve. This is the beginning of a disc bulge or a herniation. Many times people are surprised by how suddenly their pain began, and they become confused because they can't think of a specific injury, and they wonder what did they do to cause so much pain. Statistics show that if you have suffered an episode of back pain, you now have an 84% chance of a recurring episode of back pain. The bad news is this will continue to occur again and again without proper treatment. Pain begins to occur more frequently and with less provocation as each painful episode becomes more severe, lasts longer than the last episode, and is more difficult to resolve. As people continue to live by the 5 dangerous words, maybe it will go away. Many doctors and patients elect to treat their back pain with drugs, using either over-the-counter painkillers or even prescription medications. While these medications sometimes provide a degree of pain relief, patients soon find they must take more and more medication because the pain continues to return and become more severe. They just use more and more medication, masking or suppressing symptoms, and because they don't feel the warning the pain provides, their body has no way to stop them from injuring their back over and over again, causing more and more damage and increasing the underlying problem. Once drugs no longer suppress their pain, many doctors will recommend physical therapy for their patients. Sometimes physical therapy does help the back pain. However, for maximum effectiveness, the therapy has to be exact and appropriate for the diagnosis and performed at exactly the right time in the proper order. This rarely occurs, so the patient is left with chronic back pain while taking ineffective medications, possibly getting painful injections, and receiving ineffective physical therapy. When you are eventually referred to surgery, you'll find that surgeons can't promise a cure and that you may just have to learn to live with the pain for the rest of your life, or you have to risk surgery that perhaps only offers at best a 50% success rate. The fact is, many patients are worse off after surgery than they were prior to disc surgery. This is because the nerves that surround the spine are extremely sensitive, and even minimal nerve damage or the inevitable formation of scar tissue can lead to chronic, possibly severe problems with even more pain over the years to come. With lumbar surgery averaging between $30,000 to $50,000 and requiring up to 10 weeks of recovery time, surgery is a risky consideration for a problem that usually can be corrected without surgery. Of course, sometimes surgery is the only option, but with new technology offering non-surgical solutions, spinal disc surgery should be your last resort. More than a decade ago, Canada was faced with a crisis. Back pain treatment costs were rising astronomically, and there seemed to be no end in sight. In a quest to find an alternative to costly and often unsuccessful surgical procedures, scientists began exhaustive studies to see if a non-invasive mechanism could be developed to decompress discs and reduce nerve pressure in order to fix the problem associated with many types of crippling back pain. Through the application of a targeted spinal decompression traction force, the effects of disc compression and gravity can be removed and reversed, decreasing the internal pressure of the injured joint and the disc and relieving pressure on the pain-sensitive structures. While this decompressive force is applied, a negative pressure is created at the center of the injured disc. This negative pressure literally sucks the herniated nuclear material back towards the center of the disc as it directly improves the nutritional status of the disc through fluid exchange and improving the hydration of the disc. Put simply, it allows the disc to heal from the inside out. According to the American Journal of Pain Management, these decompression traction methods provide good to excellent results for up to 86% of patients with herniated or ruptured discs and 75% of patients with facet arthritis, sometimes referred to as spinal degeneration. A study that was performed by a major insurance carrier reported an 88.8% success rate with spinal decompression traction therapy. In a study published by Orthopedic Technology Review, decompression traction therapy was shown to be 86% effective in treating herniated and degenerative discs. In addition, a study in Anesthesiology News showed that after 4 years, over 91% of the patients treated remained pain-free with this non-surgical decompression traction therapy. Here's how a spinal decompression traction treatment is performed. You are secured to a special table using a comfortable harness system. This stabilizes both your hips and your pelvis for effective decompression traction. The table is adjusted and set to the proper tension and angle for distraction, allowing the specific discs that are causing your pain to be targeted for correction. You just simply relax while the process creates a decompressive effect in your back that helps the herniated material return to its normal position and stops your pain. Patients frequently describe the treatment as a gentle, intermittent pulling on their back. Spinal decompression therapy can be so relaxing that patients have even fallen asleep during their treatment. Each treatment requires about 30 minutes. Patients typically undergo 20 to 25 treatment sessions over a 4 to 6 week period to completely restore their function and allow complete healing to occur. It is important to note that many patients report relief after just a few of these treatments. Many people will ask if insurance will cover the decompression therapy. Some plans do cover spinal decompression traction therapy, but unfortunately many carriers and plans don't, and some people simply don't have insurance. Please, don't let money prevent you from regaining your full health potential and finally leaving your pain behind you for good. If spinal decompression therapy is right for you, we'll work out payment arrangements so that you can afford to get the care that you need. It is important for you to know that your back pain is just the outward symptom of the bigger underlying problem. The pain is not the problem itself, and you've got nothing to lose but your pain. So please, take the first step to living pain-free once again. Discover the benefits of spinal decompression traction therapy.